Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome and thank you for joining our Redefining Medicine weekly podcast. I'm excited to welcome Dr. Myles Spar, Chief Medical Officer for Vault Health and founder of the Integrative Medicine program at Simsman Health and Wellness Center. Welcome, Dr. Spar. Thank you for joining us.
Thank you. It's great to be here.
Great. Let's get started. In 2019, you left private practice and became Chief Medical Officer at Vault Health. Can you share with us the experience of that transition and what the role entails?
It's a very different type of work environment when you're working for a startup, number one, when you're working for a corporation. And it's something I was really excited to do, partly because as the CEO told me when they were recruiting me, he said, look, right now you're doing your own thing. And I was doing my own kind of performance medicine program in California. And I was everybody, right? I was the clinician and I was the chief marketing officer and the chief executive officer and the chief technology officer and the chief information, everything. And it was kind of difficult. And as a lot of your listeners are probably familiar with. And so he said, look, how about you come to a company where we have venture capital funding, we have a CEO, we have a marketing person, we have technology, we have a chief operations officer. So you can actually focus on what you know best, what you're trained to do. And that's how to really present clinical programs to people that want to improve their performance. In my case, it was focusing on men's health. And it was such an enticing opportunity to get to not have to listen to like marketing DVDs and marketing podcasts. Instead, I could listen to clinical podcasts and watch clinical things, which is really what I'm more interested in. So it's been great from that perspective.
How has your role been disrupted or changed by COVID-19?
Quite a bit, as for all of us, the whole world changed. I mean, we've been somewhat fortunate in that we were launching a national medical practice focusing on men's health. And we actually announced our Series A round of funding in March, on March 13th. I was on the floor of the New York Stock Exchange announcing, for publicity, our round of funding. And that's obviously when the world started to really change dramatically. Fortunately, though, we had a relationship with a lab that got the first of EUA authorization for an at-home saliva test. And we had already built this network of practitioners to do telemedicine for men's health. So we were able to pivot to do telemedicine via for supervised collection of saliva tests, which are as good or better than the nasal swabs for COVID. And so that's been a big part of our business. We're still doing men's health, but throughout the pandemic, we've been able to do COVID testing and making it easier for people to get back to work, to get to travel. So it's been actually, I hate to say it, exciting because it's enabled us to really use our telemedicine network and actually hire more people and grow throughout this time, and especially people that might have lost other jobs at places that couldn't pivot to a telemedicine practice.
Your work abroad appears to have had a significant impact on how you view medicine and the role of healthcare providers. Will you share with us the experience you had while working abroad and how it influenced your career trajectory?
So, I worked with Doctors Without Borders, and part of that was born out of really frustration with the medical system and the way I was trained and the way many of us are trained as doctors in the United States, where we're really trained more to do acute care medicine than to do anything about prevention or anything that can really help someone know what they can do to stay well and to perform better. And that was really my interest. And so after about a year of practice, I thought, this is frustrating. All I'm really trained to do is acute care medicine. I had a master's in public health because I had done a fellowship in health services research. And I said, if I only really know how to do acute care medicine, I may as well do that where it's most acutely needed. And that's in all of these places around the world, where at that time I was doing HIV medicine and tuberculosis medicine. So I joined Doctors Without Borders. And what I really learned traveling to different countries with that amazing organization is a lot of the things I didn't learn in this country around prevention and wellness and what keeps people from being as sick as they might otherwise be. So I saw people, for example, with the same stages of HIV I would see in the US, but in other countries, they were somehow thriving a little bit better. They certainly needed the medications we were bringing. And don't get me wrong, they wouldn't have done well in the long term without those medicines. But in the short term, they seem to be doing better. And so I started looking at what else is there to thriving into health other than medications, because clearly they didn't have the medications, but they were doing decently well. And I realized it's a lot of it around connection, around sense of purpose, around support from their communities, around eating actually unprocessed foods because they were eating more natural foods that were available in their local areas and getting more physical activity because they had to just to get water, they had to walk. And so I came back to the US really dedicated to finding out what else can I put in my toolkit that I didn't learn about in medical school that isn't written down on a prescription pad. And that led me to integrative medicine, to regenerative medicine, to anti-aging medicine, to functional medicine, to really learn what's the science behind keeping someone well, preventing problems, performing at your best, and then also needing medicines when it's appropriate.
You will be leading a number of sessions during the upcoming Module 1 Endocrinology. Let's first discuss male hormones. What advancements and changes will you be covering?
Sure. Well, I think first of all, the recognition that many men have low testosterone. 40% of men over 40 have low testosterone. And the symptoms might not just be sexual symptoms. They can actually be fatigue, low energy in general. They can have body composition that can cause you to have an inability to gain muscle mass or to lose belly fat. So there are a lot of symptoms. And even more than that, there's more and more evidence that I'll be presenting about how low T actually impacts one's risk for heart disease, for early mortality. So how important it is to just know what your T level is, and for practitioners to be recognizing the need to check testosterone. We find a lot of guys will have these symptoms, even mood changes that go along with low T, and they're not even having their T checked by their practitioner. So I want the attendees to really understand why it's important to check what the symptoms are of testosterone deficiency, and then all of the newer ways to treat it, because we know there's creams and shots, but there are new types of formulations that can be used for subcutaneous injections. There's a new oral formulation of testosterone that's recently available for guys who don't want to do shots and aren't comfortable doing topical. So we'll be talking about some of the newer ways of treating low testosterone.
You are also leading a session titled HGH Oxytocin Advanced Clinical Applications. Will you provide us with a preview of this session as well, and why this is a valuable one to cover?
Sure. Well, I think it covers a lot of different things that are very important. Number one, natural ways to boost testosterone or to alleviate some of those symptoms. So for guys who don't want to take testosterone for some reason, or for practitioners who feel it's not right for a patient, there are some things you can do to help their symptoms of low T, or even potentially to naturally boost T a little bit. And some of those symptoms we're hearing more and more about, especially during the pandemic, are libido issues and just a difficulty really feeling bonded with a romantic partner. Because to some degree, when you're stuck at home all the time, it's hard to keep that romantic kind of flame alive. So that's where the oxytocin comes in. Oxytocin is a natural hormone. It's the bonding hormone. It gets produced when you're hugging someone for a ridiculously long period of time. It gets produced by a mother when she's giving birth to help bonding with the fetus, with the baby. And so it's something that we now know there's good evidence that it can actually help boost that sense of bonding with your romantic partner. So we'll talk about how that can be used, and that's especially good during these times, like I said, when people are feeling maybe a little more annoyed with their partners that they're stuck at home with all the time than they used to be pre-pandemic. And then we'll be talking about things like what to do about special cases, guys who want to retain fertility, but taking testosterone isn't great for that. So that's where the HCG comes in. It's a great solution for guys who need more T, yet you can't really give them T because that would potentially impair their fertility. So those are some of the highlights.
As an established expert in men's health that has worked in a variety of different functions within the field, from private practitioner, MBA medical consultant, clinical instructor, CEO, and more, how would you say the field of men's health has evolved since you first began?
A lot of it has to do with the recognition that it's a legitimate field and that men have legitimate issues that are unique to men. It used to be, I'd say, when I started doing men's health, over 10 years ago, I have 2 books out, one I edited and one I wrote on men's health. And before those came out, men's health in the US especially was kind of seen as just everything that isn't women's health. It wasn't really felt to be its own specialty, whereas it was recognized as such more in Europe and in Australia, as departments of andrology were cropping up looking at unique aspects of men's health. And so that's really how it's evolved. It's become more acknowledged in this country as well, that yes, men's health is an issue. Men are dying younger than women. Men, quote unquote, win at 9 of the top 10 causes of death. Why is that? It's not genetic. It's not pre-programmed. It's because we're not addressing the issues men have, and we're not reaching them as kind of practitioners in ways that we should. The messaging we use around prevention might not resonate with men as well as it does with women. So there's a lot of understanding now, and there used to not be, that men's health actually is a legitimate field unto itself. I'd say the biggest thing I'm seeing now as we look ahead is there's more and more recognition among men that it's okay to get help. It's okay to get yourself checked out. Men are half as likely historically to even have a doctor that they feel they can go to. But we're finding more and more men are saying, that's kind of not okay. And that I do want to go somewhere, and it's not a sign of weakness to check my testosterone and see if that's why I'm not gaining muscle mass from working out. This old fashioned sense of John Wayne stoicism is thankfully starting to kind of wane away a little bit. And guys are recognizing that there are doctors that understand them, that hear them, that can help them, like we have at Vault Health, and that a lot of other men's health practitioners are doing, and that you can ask for help and get help and actually be stronger as a man, as opposed to that being a sign of weakness. So the sense of masculinity is evolving in a really healthy way.
I want to thank you so much, Dr. Spar, for your time today. We certainly appreciate you sharing your insight, and thank you to all of our listeners.
Thank you. It's great, Lindsay.